Hello, everybody. Welcome to Parkinson's Chat with Richard London. Actually, tonight is Health Chat with Richard London. My guest tonight is Olga Lucia. Olga is an attorney in the New York area, speaker, writer, in the process of coming out with her first book. Congratulations. She's an inspiration to a lot of people. She's going to talk a little bit tonight about the number of health challenges that she's been through, both personally, multitude of challenges personally, and as a caregiver, caretaker for her mother and her grandmother, and what drives Olga and her attitude about life that brings us to where we are today. So welcome, Olga. How are you?
Good, thank you, Rich. How are you?
I'm doing wonderful.
I want to say that it's a privilege to be on your show. I've read about your story, and when we spoke, I was very moved by your story. And I'll start by saying that when we finish talking about what I've lived through, what my family has lived through, it's going to seem like a lot. But I'll start at the outset to say that I feel very blessed to be alive, and I feel that I'm honored to have been able to have lived through the amount of health challenges that I endure, because they make me the person that I am, and they allow me to live in gratitude for what I have. And I'll start by saying that I was born severely asthmatic. It's something that instead of getting green eyes from my dad, we all inherited asthma. So I'm sure like many other people have gotten. And so I lived with, with being sick when I was very young. When I turned 15, they found a pituitary tumor in my brain, and they wanted to operate and take it out. Instead of opting to do that, I decided to go to college. I was first generation to go to college, and I went off to Cornell. I had a scholarship, and I, instead of being overwhelmed and saying like, oh my gosh, why am I having to endure this? I felt very much like this was something that I had to live through because it was going to make me the person I was going to be. And I got this attitude from my grandmother, my maternal grandmother, and my father. They taught me to make the best out of the circumstances that I was faced with, and they taught me that everything that we live through is for a reason, and that it's not, you don't have to look at an illness or something like a tumor as a punishment, that it's just something, not like why me and not somebody else. It's just something that you live through.
And one of the very interesting things, and that's one of the hallmarks of the message that I bring across and the people that are on the show, is that's not just some trite information that's thrown out. You're someone who has lived through that and come out the other side and proved that that's the way you actually do live your life.
That's how I live my life. I still have the tumor in my head. And it's not just so much an issue of faith. It was an issue that at that age, I just had so many other things to live for, as opposed to like giving up on my future of going to college, of my future of starting my life, and opting to not start my life at that age, and living a life of sickness, of living a life of one doctor's appointment after another. Now that's my life. I'm not saying it's not my life in large part. But I also wanted to have a life of education, of possibilities, of a different life than what my family had had as a family of immigrants here. While I was in college, I had all the things that come, unfortunately, that came with my tumor. They came with hormone deficiencies. They came with migraines. I had blackouts, unfortunately. I had loss of peripheral vision. And while this was going on, in large part, the person I looked up to that was my mentor, my grandmother, who I'm named after, was diagnosed with colon cancer. It was a last stage colon cancer. And while I was going to school 4 to 5 hours away, I drove back and forth to be with her for her treatments, and I was with her the night that she died. Now, it was hard for me to lose her. She didn't get to see me to graduate from college or any of my other schools, but I was her caretaker. I didn't take off from school because she didn't want me to. I didn't take off a semester, but I was there for her during her last months. And my grandmother's attitude, when her last Christmas with us, everybody was sad, and my grandmother said, let's have a party for New Year's Eve. So let's decorate the house. She said, I know I have colon cancer, but I'm dying. Let's eat fried food, my favorite food. So we fried everything. She wanted fried calamari. She wanted fried chicken. She wanted fried pork chops. And, you know, that's what we made her. That's what she wanted. You know, people were like, I don't think she's supposed to be eating this. And we were like, she's dying in the next 4 to 5 months. Let's make it a party. She wanted a party, and that's what we gave her. And that's what I said is that's where I kind of try to get this attitude from. She was a realist at the same time that she had hope. She went to her treatments, but she said, you know, I have hope, but I'm also a realist. And so, unfortunately, my grandmother died, but I was blessed enough to be there with her for these type of celebrations, and you know, the night that she passed away.
Wow. That's your grandmother?
And that's my grandmother. Now, for the holidays, this has nothing to do with my story, but she made a very poor apartment in Elmhurst, Queens, into the Macy's of Elmhurst, Queens. And when she was done decorating the house, these were little ribbons, and she even made decorations on the walls.
That's great.
So when I was, after undergrad, I went to law school in D.C., and when I was done with law school, my plans were to stay in D.C. My mother was diagnosed with multiple myeloma. Now, I'm an only child, so as a dutiful child, I returned to New York to take care of her, but I still continued working full-time as a public defender while I took care of my health, and I took care of my mom.
You do what you need to do, right?
Make it work. Now, when my mother was diagnosed, she was very overwhelmed with the diagnosis. My grandmother died in less than 9 months. And I tried to say to my mother, you know, let's try meditation. You have to like not be as negative. But for her, she took it as a death sentence. There was no way for me to convince my mother that multiple myeloma, people lived many years with it, that it didn't have to be a death sentence. I'd never seen her be this negative. I couldn't get her to not, she couldn't even talk about having cancer. Mm. While I was taking care of my mother and working full time, I noticed that I was losing my hair. I noticed that my joints were hurting. So I went in to see my doctor, and I got a blood test. The doctor had been calling me, leaving messages, but I had one trial after another. I had to take my mother to appointments. So finally she reached me on the phone. She said, I need to see you. I said, I don't have time to come see you. I'm trying to manage Mom. I'm trying to manage my job. Finally, over the phone, she says to me, Olga, you have lupus. To which, of course, because I think I'm very smart, I say, I can't have lupus because I haven't been around any deer and I haven't been bitten by any ticks. Of course, she says to me, Olga, you dumb, I'm not going to say a curse word on your show, but she says, you dumb person, that's Lyme disease. I'm not talking about Lyme disease. I'm talking about lupus. I had no idea, Rich, what lupus was. I didn't know anything about autoimmune disorders, anything like that. Of course, I went in eating humble pie, right?
Right.
And I said, oh, what's lupus? Of course, this is the first time I learned about autoimmune disorders, and I learned that lupus, for your viewers who don't know anything about it, is one of many autoimmune disorders that attacks your immune system. So it can do something as simple as attack your hair, right? You lose your hair. It can attack your joints. So your joints, your knees, your fingers can get swollen. It can also attack your heart. It can attack your liver. It can attack your kidneys. So it can be a disease that can kill you, and it can also be a disease that you can manage if you work with your doctor. So thankfully, I had a good doctor. She helped me find a good rheumatologist. And this was the first time that I really started learning the importance of having a good relationship with your doctor, a working relationship with your doctor. The first doctor she sent me to I thought was very nice, but I walked out of that office with, and then soon thereafter I was diagnosed with Sjogren's and Raynaud's, which are two other autoimmune disorders that affect your body in different ways. And I walked out of that office with like a slew of like 10 different medicines, from steroids to different things. And that was when I really learned. I went to my primary care physician and I said, look, I get it. I have something serious and I have to manage this just like I manage my pituitary issue, my hormone deficiencies. But they want to put me on like almost a dozen medicines. This is too much. Like I can't do this. And my primary care physician said, you can go to a different doctor. You can say, I can't take all this medicine. And that's when I really first started feeling empowered in my relationship with physicians. That's when I went to the new rheumatologist with my arms crossed like this, and I said, these are the medical conditions I have, and I'm not taking this medicine. And the doctor said, hey, you're just meeting me. Let's see what your numbers are. Let's see what you actually need. And we established a relationship where I said, I'm willing to take steroids if it's an emergency. I'm willing, where I had a say in my care. And these diseases were the first ones that really helped me say, then I went to my endocrinologist that treats my pituitary tumor, and I said, you know what? I'm taking this medicine that has never done anything for me for like the past 10 plus years, and I don't want to take that medicine anymore. I just want to take what I absolutely have to take. What do I absolutely have to take? And I really started tapering down my meds to what I absolutely only had to take.
Well, I think that it is such a crime in America that people are over-medicated to the point they are because they accept whatever the doctors say without standing up for themselves. So bravo for you.
It's funny because here's somebody, right, that's a licensed attorney. I'm a litigator, right? I stand up for other people. But, you walk into the doctor's office and you see their white coat and you see the MD, right? And all of a sudden you become like you can't be a mouthpiece for yourself, right?
Right.
It happens, I think, to all of us. It's like a universal thing that happens. So, I have these medical issues. And in the process of, continuing to work, trying to balance these new diseases that I have, I get dehydrated, and I end up in the hospital in August of 2000 because of severe dehydration. When I get admitted, they give me something called hypertonic IV, and it has 3 times the amount of sodium than a normal bag of IV. My blood was supposed to be drawn every 3 to 4 hours because it's dangerous to take hypertonic IV for too long. They even put a PICC line in me so that they can ensure easy access to my veins. But what happens is that 2 hours pass, 4 hours pass, 12 hours pass, 36 hours pass, and the doctors have not drawn my blood. Now, I, of course, have pushed the call button. My family has gone. My friends have gone to the nurse's station asking, for my blood to be drawn. And eventually what happens is that all this extra sodium makes my brain swell, and I go into a coma. And the unnecessary sodium causes loss of oxygen to my brain, and the myelin, which is the protective sheath around the nerves, everywhere in your brain, in your whole body, causes the myelin and the nerves of my brain to die. Basically, as the doctor said, they fried up. The sodium fried up the myelin. In the MRI showing about 1/3 of my brain. So when I came out of the coma, I had literally lost the use of 1/3 of my brain. I was unable to communicate because I had a facial atrophy, I was drooling, I had speech issues, I had aphasia, which I still have. I forget words. I've learned to compensate. So if I want to say roses, I'll say red flowers with petals. So I'll describe the word for you because I can't remember the word.
Right.
I had vestibular issues, so I had a very severe balance issues. So I could not walk, not because my legs weren't working, but because I couldn't stand because I would fall right over. I couldn't use my hands because they were like basically I couldn't close them or open them. So I couldn't hold a pen, I couldn't hold a fork, I couldn't feed myself. So I needed extensive amount of therapy. So I had both inpatient and outpatient therapy for over 6 years. I had to even sue my employer's insurance because they refused to cover me. And my mother at this point got very, very sick. And I had to stop therapy to try to take care of her, even though I wasn't very well to take care of myself.
What was your attitude through this whole time, like while you were going through it?
When this happened, all of the positive, mindset that I had been raised with went out the window. I was depressed. I was utterly depressed. I did not have a why me attitude. I had a no one in life should have to live like this. My whole entire existence, my whole life had been taken out from under me. I wanted to be a judge. I had made all the connections to try to be a judge. My life's work was advocating for other people. I could no longer do this. I could no longer do the one thing I wanted to do, which was take care of my mother. I was no longer a good caretaker anymore. And I kept, literally, I wanted to die. I wanted to go to bed one night and just not wake up the next day. And I wasn't making any progress in therapy. Like, I worked really hard. I did my homework, but I wasn't making progress. And one night I was so sad, and I realized my mother was sad. My boyfriend, Terrence, who had been by my side through all of this, he was sad. One night I didn't sleep all night. And I really thought about, like, where I was and what was I doing? Like, I wasn't getting any better. Like, what was going on? And I made a real honest assessment, and I said, Olga, what has changed when all of this? Like, what happened before? You know, you were diagnosed with a brain tumor. You were like, I'm going to be fine. You were diagnosed with autoimmune disorders. You were like, I'm going to be fine. And now your attitude is completely different. You don't have any spiritual relationship anymore. Your relationship with God has gone out the window. Like, you have to be honest with yourself. And that's when I realized that what had changed was me. What had changed was my attitude with myself, with how I felt about illness, with my own relationship and with spirituality. And that night I vowed to change my, I changed my relationship with my attitude, change my negative attitude. I made my mind up that I was going to really assess this brain injury, like everything else that had happened to me, was about me learning something bigger than me, to really, maybe I was supposed to talk to other people about what happened. Maybe I was supposed to turn this into the life lesson that it was. And that night, I changed my attitude. And the next morning, I woke up and I went into therapy with a new attitude. I apologized to my family. I apologized to my therapist. And it was overnight that I saw the progress. Overnight, I had gone from wheelchair to walker, but I went from walker to cane. And you know, I needed a cane for quite a long time, but I made a lot of progress, and my cognitive, everything really clicked into place. And more importantly, I finally felt like me again. My sense of humor was back. And I even, you know, I even started, you know, I had put on a lot of weight because I was so sedentary. I even felt like smiling and taking pictures again, which I had forbidden people from even taking pictures of me because I felt I didn't feel like myself. I felt disgusted with myself. And I finally felt like me. Like, I started making jokes, like, who's the one that's going to forget whatever has to, you know, like, it was okay. Like, who's the one who's, you know, trying to, and you'll, I'm sure, get this. Like, who's the one who's trying to cut a pork chop and it's going to go flying across the table? Right. It's me, because my hands shake because I have dyskinesia. Like, and people looked at me like, it's okay? Really? We can joke again around you? And it was, you know, I finally was, you know, I felt like I was finally me myself again.
Wow. Attitude, it is just so true that your attitude affects so much about your physical well-being. You know, what your mind says is what your body follows.
You know, like, and I remember saying this to my therapist, and she wrote it down, and I ran into her many years later, and she said, what you said to me that day, I say to patients. And I think I said something to her like, if you are putting out negative vibes and a negative attitude, you're going to attract negativity. Like, if you are saying, I'm not going to be able to walk, or I'm not going to be able to balance my checkbook, because I had to be retaught how to balance my checkbook.
Right.
And I would have preferred to have, like, you know, my wisdom teeth pulled, honestly, than try to look at a checkbook. Then you're not going to be able to do it, because that's what you're attracting. But if you come in with a positive attitude, you're going to attract positivity. You're going to attract what it is that you're putting out. And you know, she kept trying to tell that to her patients. She said, look, I had a patient who could not write, who could not balance a checkbook, and she walked out of here, you know, I'm not going to give away what we're getting to, but she walked out of here doing things that none of us even foresaw her doing.
Right. That's awesome. So some of the additional things you just went through about sense of humor, that is great.
Right. I think it's all there. Yeah. And, you know, and again, Terrence, this man who didn't have to be by me, that's Terrence and I. So that chair you see there, that was my shower chair, which once I changed my whole mindset, we were able to get out of the bathroom and I didn't need it to shower. I just held on because, again, with the balance issues. So I remember asking for it to get taken out of the bathroom because I didn't want it and I didn't need it anymore.
Very good.
So it became part of the living room furniture. So my mother, unfortunately, worsened and she died. And unfortunately, she remained angry at the world and was never able to change her mindset. When I was, really had changed and was walking around the house saying, Mom, you got to join me in this change of point of view, she didn't meet me there, And I was prepared for her loss, but unfortunately, a year after she died, my father died of Alzheimer's. And that was very unexpected, and I wasn't prepared for his loss. His Alzheimer's had been recently diagnosed. That was my mother 2 months before she died, and that was my dad in Puerto Rico. So Terrence, like I said, who had been my boyfriend in 2004, he asked me to marry him. And I said to him I would be honored, but only when I could walk without a cane, because I had a goal in mind. And I did a lot of vestibular therapy until I could walk without a cane. And of course, I picked a venue where I had to go down a set of stairs, and the stairs were curved. To which he said, come on, babe, we could pick like a one-floor venue. And I said, no, of course not. And then when we started talking about children, it was my dream for us to have our own child. And with the blessing and help of doctors, we worked it out. I detoxed from the anti-seizure meds because the brain injury left me with a seizure disorder. And it took a little longer, but we were blessed to have our own daughter, Isabella, and she's now 6.5. Now, another big goal that I had for myself was to go back to law, and I don't think I put this here. I wanted to go back to practicing law, and I did get my license again. And before I had my daughter, I did practice law for almost 2 years. But when we had her, I stayed home with her for 2.5 years until she went to preschool. So I didn't mention that, but I do have my license again, and I did go back to practicing law. I did not do criminal law. I did family law. And I did health law. So I help people against fight Medicare HMOs. But another dream of mine was to go back to school. I'd been a nerd my whole life, and in 2012 I went back to a program at Columbia. I just graduated in December, and I graduated with better grades than I ever got in law school or undergrad.
Congratulations.
Thank you. I keep telling my husband there's another degree I want to get, and he's like, can we not do school for another year? And while I was in school, my Raynaud's, which is one of the autoimmune disorders that attacks my extremities, so blood can't get to like my fingertips, my nose, or my feet, got very severe, so that I couldn't have any. I had basically no circulation to my right hand, and they had to do a 7-hour surgery while I was while I was presently enrolled in school. And I decided not to withdraw from school. I had the surgery, and I just knew that somehow with my left hand, and I would make it work. I would get through that semester, write my thesis paper, and I was able to. It wasn't easy, but I just tried. I stayed positive. And this is what my hand looked like right after the surgery.
That is not a fun picture.
No, the doctor said anywhere about 100 to like 110 stitches. It was 5 cuts. What they did was microsurgery on the veins. They opened it up. Unfortunately, it didn't work terribly well, and I still have, I have some problems with my right hand, but I'm on a whole bunch of meds to try to get better circulation in there. While they were doing all this testing, we found out that I have 3 more autoimmune disorders. I have rheumatoid arthritis, osteoarthritis, and scleroderma. But, the day that the doctor gave me the diagnosis, it was a different doctor, and, she sat there, she was touching my knee, and I looked at her and I said, okay, but how's my hand doing? She said, you don't need me to explain that to you? And I said, honey, I'm not going to take medicine for it. I refuse to take any more medicine, and it's going to be fine. Like, if it gets acute, we'll deal with it, but otherwise it's going to be fine. Do you have any more news about my hand? And she just couldn't believe that I wasn't like asking for literature. Or I said, you know, is it like acute right now? Do I have to? She said, no, it's just, you know, it tested in your blood work. I said, oh, honey, my blood work is so, I bet you there's more stuff in my blood work that you don't even know about. But I just came for a follow-up on my hand. And I walked out of there, and I just kept on going. It wasn't like till 2 months later that I mentioned to my husband, because my knee was hurting. I said, oh, yeah, I'm arthritic now. I totally forgot I'm arthritic now.
Amazing. And this is your happy family.
That is my happy family. That is my daughter, that if you look up Oedipus complex, there's a picture of my husband and my daughter.
Oh.
I'm sort of like the sidekick, really.
Well, there's a tremendous, tremendous difference between this picture of you and the other picture of you with all that weight.
Yes, there is. Yes. There is. I did that, and that's just the side. That was for me. I just wanted to get back to feeling healthy. Now, there was this a study that I read, this great article done on happiness in people with disability. And the survey revealed that both people who were born with disabilities and people who become disabled report a quality of life as good as, and sometimes even better, than non-disabled people. And they were talking about people who become disabled because they become blind, because they become paralyzed. And what it shows is that people with, you know, severe illness, that people, we adapt. We figure out what's important in life, and we just seek to live happy, fulfilled lives. And I put the link there, and I'm not sure if the viewers are going to have access to it, or maybe you can put it on your website, but the article was really, really interesting. And it just sort of, I think it goes to the point that you make, and I think the point that I'm making, which is that, you know, I think that you have two choices, right? I mean, you can, you know, you can say, yes, this is what I have, and I'm going to choose to not let it consume my life, or I'm going to think negative about it. I'm not going to let it stop me from living the dreams that I want to live, or I can't, you know, or I can just stop life right here and wallow in this reality that I have. You can coexist with it. It does not have to become your life.
I will put the link on my website. That is awesome. It's this is exactly the kind of thing that, you know, I tell people about. The guests on my show tell people about. But what I love about the opportunity that we have here is we can, you know, point out, say, hey, this is not just hyperbole. See, what I have is, I call it Parkinson's mouth. Sometimes
I have brain injury mouth. That word is way too complicated for me.
But anyway, it's not just crap that we're talking about. It's stuff that we live.
Right.
And when you listen to somebody who's gone through what you've gone through, and who can still say, hey, listen to me, this is why I'm happy, this is what fulfills my life, this is the attitude, this is what makes the difference between feeling sorry for myself because I skinned my knee, or not caring because I have a brain tumor. And it's, your quality of life is all in your attitude in life, I believe.
Right, I agree. Yesterday, not yesterday, but Thursday, I had 2 grand mal seizures. Those are big seizures. And then I had a few petit mal seizures afterwards. And I got sick. I threw up. I was sick. And when I laid down in bed, you know, I closed my eyes and I prayed and I smiled. I forced a smile on my face. And I was grateful for what the life I have, just grateful for my reality, that I am the person that I am, that I can have those experiences and still understand that that's just a minor setback, even a setback, you know. Friday, I knew what I had to do. Like, I know how to care for myself. I knew that it couldn't be a day that I was going to go to great adventures. I wasn't going to Six Flags on Friday after a seizure on Thursday. Like, I know how to manage my life. You know, I knew how much I could do. I knew how much more I could do on Sunday. Like, I know I'm at the point where I know how to take care of myself. I know that I don't have to let it consume my whole life. I don't have to call and scare people about it. And I'm able to take care of myself. And And it was, it's not an easy thing. I'm not saying at all. The first couple of seizures I had, I didn't know what to do with them. They were overwhelming. You have to learn how to live with your illness. Obviously, any new diagnosis is overwhelming, but it doesn't have to stop you, from your dreams or from doing the things that you want to do. I think, we're only limited by our thoughts. And I think, obviously, there's limitations to access to places. I was just in California, and we went to the California Academy of Science, and their wheelchair access elevator wasn't working, and a woman was there, and she's like, oh, well, I guess we're not going to be able to go in. I went, and I complained about it, and I told them this is a shame. I mean, you're the California Academy of Science. How could your wheelchair lift not be working? I mean, you're limiting a whole population of people not to come. And they said to me that they had put in a request to fix it like a month ago. I said, for a whole month, people can't come here? I mean, I'm not saying that it's not a reality, that there's limitations when you are disabled or you have illness, but it doesn't have to limit you from trying to do things and getting out there. And I run with the Achilles Athletic Club, and I'm not saying their full name right, but with their help, they gave me the confidence, and I ran 2 half marathons, and I ran a couple of other smaller races. But I run with people, and I have to have guides because I can't judge the space on my sides. But I run with people that are completely blind, and they just run with a tether, a tiny little tether. And when I see them run, I'm like, I'm so limited in what I do in comparison to what other people are doing. I mean, they're so inspirational to me to see these other people reach the things that they can do.
That is incredible. It is such a great lesson. Such a great lesson.
I finished my presentation by also saying about that if you're doing what makes you happy, like when I was in school, as hard as it was to study late and to study after I put my daughter to bed, it made me happy. And when I was happy, I loved myself. And I think that when you're loving yourself and you're radiating positive attitude, that impacts the people around you. I was able to have other people that I met at her school. I have other moms that are going back to school. Just because they saw me, they were like, wow, Olga, what are you doing? I was carrying a backpack bigger than, half of the school. They felt inclined to go back to school. I feel like you should do the things that make you happy because it'll help you love yourself. It'll help you be a better whatever it is that you are, mom, dad, person, whatever. I think that, the limited time that we're here, we should only really focus on doing those things that really fulfill us and make us happy, and it'll help us live, just a better life.
A while ago, I had on the show Dr. Bernie Siegel, and Dr. Siegel is a multi-time author. I think he's got 13 books out, and he was the pioneer in the 70s and 80s about attitude healing, and he had cancer patients, terminal cancer patients, and he writes about how attitude made so much difference between how someone was going to live, how long they were going to live, the quality of their life, and you're a living, thriving example of that.
I agree. My mother had multiple myeloma, and the doctor said people with multiple myeloma can live like 7, 8, 10 longer. And we had a friend who was who's the youngest person in medical history diagnosed with multiple myeloma. He was diagnosed at 19, and he just recently died in his 40s. And my mother, the cancer consumed her in 3 years. And she had a cancer that life expectancy of it is much longer. And I think in large part it was because she just took it. She didn't see anything. She couldn't put any positive spin on it. There was no way that she could ever see it as, this bone marrow transplant is going to work. This treatment is going to work. Everything she saw was skepticism, with the glass half empty. Is that the
empty?
term?
Yeah.
Yeah. So I think it's so true that if you have a positive mindset, it absolutely impacts your treatment, your medical condition, whatever it is that you're dealing with, or how you take care of whatever patient is you're taking care of. My grandmother was supposed to die within 3 to 6 months, and she managed to live 9 months.
Wow. Now, how does Terrence handle all of your energy?
He's overwhelmed by it. I think he balances me out. He's a realist, and when I say to him, I want to learn I want to jump out of a plane, or I want to do something else, he's like, why don't we ask the doctors first? So he slows me down in the way that I think is necessary, but he's my full supporter. And in fact, we were about to adopt when I said to him through tears that I really, really want to have, I felt like the biggest gift that I could try to give him was our own child. I said, you have, given up so much. You've stood by my side when somebody else would have ran. I said to him, I think I would have run if our roles were reversed. And if I could give you our own child, that to me is the biggest gift I could give you to repay you and say thank you for what you've done. And he said, I'm more concerned about your health. And then, he's just stood by my side and been an amazing, he's my best friend and my partner, and I couldn't have asked for a better. I feel like that's how God has balanced all of this out, right? And there shouldn't be any balancing out, but I feel like God is like, come on, man, you've gotten one of the best husbands around. Don't worry, this is all balanced out.
Well, I feel, and just from what you said, I know you do too, that the lives that we have here are opportunities to learn, to grow. Appreciating what you have is what it's all about. And sitting there feeling sorry for yourself does absolutely nothing to enhance your life or that of the ones around you.
Absolutely.
That's
Absolutely.
cool. So your daughter's 6.5.
She is 6.5 going on 16, but yes.
Does she know Mommy has any kind of health issues?
She does. So we didn't know how much we were going to tell her or when, but then 2 years ago, I had a grand mal seizure on the street, and I had to be, I didn't want to go to the ER, and I was brought here, but I was all bloodied, and eventually did have to go to the hospital because I had a hematoma that welled up, and so she saw it, and we had to explain to her what happened. She thought I had been attacked because it looked so bad.
Wow.
So we had to tell her, what happened. So then she knows that, if we're home, it's just her and I, that she has to call 911 and just say that Mommy's had a seizure. And I have my medical alert at all times. And we hid what happened with my hand. And then she, at school, started saying how scared she was for Mommy because Mommy was in the hospital. Mommy had this big bandage. So then we talked to a counselor at her school, and the counselor said the best thing you can do is on a day that you're changing your bandages, let her help you with that. If it's not too overwhelming, let her help her. If she's overwhelmed, just tell her she could leave. But no, she wanted to help wipe it, and she helped put the bandage on me. She saw all those stitches with all the crusty blood on it, and she was a total trooper about it. So I think she worries a lot, and we've had her speak to a therapist a couple times because she feels like she has to take care of me, and we are trying to explain to her she doesn't have to. I think for her young age, she's taken on a lot more than she has to, but she could have ended up with a lot worse parents, right?
But she's a very normal little girl. She wants to be what when she grows up?
She wants to be a teacher, a swimmer, a dancer, and a mommy.
Sounds like she can do it all.
I'm sure she'll add things to the list, but that's what she wants to do for now.
Well, that's very cool.
But no, I mean, listen, I think all of us have doubts when we bring them into the world, right? We feel like, oh, but she's the biggest blessing we have.
Now, do you have any brothers or sisters?
I have only half siblings from my father's side, and I'm thankfully gotten closer to them as I got older. But I was very a bookworm when I was smaller, when I was younger. But as I gotten older, I've had an opportunity to get closer to them.
Well, the normal name of the show, like I had said, is Parkinson's Chat with Richard London. Tonight, it really has turned into Health Chat with Richard London. But I want to point out to my regular audience that people with Parkinson's, we got no excuses. With me, I happen to have some more health maladies than most other people that are just people with Parkinson's, in that um, I've had 16 surgeries in my life, 9 of them as a result of a car accident, 10-year cancer survivor, and Parkinson's disease. So more than most, I can hold myself up and say, to other people, you have no excuse not to have a good attitude and want to enjoy your life. But Olga, you certainly take everybody's excuse away.
Well, I feel like I think I lived through all of that so that I could help people see that really you can impact what your ultimate, how you live your life, how your life will end up. If you choose to go for what you want, if you choose to have a positive mindset about it, you will have a positive life. You will have a fulfilled, happy life. You will set yourself short if you shortchange yourself, if you put excuses up as for why you don't go out for the things that you want to do, and if you decide to live with, well, I can't do that because I'm sick, or I can't do this because I have this or the other thing, then that's going to be your reality.
So I brought up your website, olgaluciatorres.com, OLGALUCIATORRES.com. Tell me what you're doing these days.
So I do public speaking, and I write articles for places that I try to get them published. I am working actively on my book, and I still have my license, so I still work on contracts and do different things for people. I'm trying to do less of the lawyering because that takes up a lot of time, but I do a little bit of everything there.
When you, what types of groups do you speak to, and what's the overall message when you speak?
So I've ended up being called a lot to universities, probably because that's where I just finished. So I've recently spoken at Columbia, at NYU, I've spoken at Cornell, I just got called back at Columbia, and I've spoken to a lot of student groups, I've spoken to sorority groups, and what I get called in to speak is really about motivating people, about telling people that you should not set limits on yourself. I haven't had a lot of opportunity. I'm trying to work with more health groups to try to speak more about, living well with illness. Don't set limits on yourself. But I end up speaking. I have to broaden my message a little bit because I've been invited more to speak to young people. But young people are having a hard time getting hired, and so they sort of have to recreate. They have a degree in one thing, but they can't find a job, and I have to speak to them about just, looking in different places, really thinking about the outside the box. Don't get limited, don't get overwhelmed. Really, let's think outside the box. So when they have a seminar like that, they bring a motivator in to get the kids energized and really get them. So I do exercises with them about when you were like this age, what were you really excited about? And then, they start thinking about how to mesh those interests, but with their current degree.
Well, sounds great. And your email address, if people want to get a hold of you.
I'm at Olga at OlgaLuciaTorres.com.
And I love your Latin accent.
It's my first language.
OLGA at OLGALUCIATORRES.com.
Yes.
Email address, and www.olgaluciatorres.com.
Yes.
That is great. What do you want to leave the people with tonight?
I know that it's hard to live with illness. I know what it's like to be, I was by my grandmother's side when she died. I was by my mother's side when she died. And I'm not at all trying to diminish how hard it is to be a caretaker. I know how absolutely consuming that can be. But I know that you can do that at the same time, and you can live with illness at the same time, that you can continue living your life. And you can live it in a fulfilling, happy manner. You can't, if you choose to let it consume you, it will consume you. If you make a conscious decision to not let it do that, to do the things that you want to do. Prioritize those things. You can do that by just one thing at a time. I'm not saying, like, let's say you were living an overwhelming life right now, that tomorrow you can wake up and be a different person. But you can do it one thing at a time. You can decide, I'm not going to be completely consumed by this. Tomorrow, I'm going to do one thing that makes me happy. Whatever it is, the thing that you used to do that makes you happy, you can wake up tomorrow and do that again. Be it spend 1 hour reading your favorite book, drinking your coffee, make a call to a friend that you haven't seen and go out for a drink, a coffee or tea. Prioritize yourself again. Do the things that you used to do that will bring you happiness again. Or make it a big thing. If you wanted to apply for a different job, apply back to school, whatever it is your dream is. You want to go skydiving, do it. Make it. If your birthday is coming up and you wanted to do something really out there, do it. My friend was turning 30 and we had a meeting and she said, I said, what are you doing for your 30th? She said, I don't have any big ideas. I said, well, what did you want to do before? Well, what was a big dream of yours? What a bucket list dream? She said, I want to go skydiving. I said, girl, send out an email, see who takes, and do it. A lot of us said we might. In the end, she was the only one who went up on the plane, but we were there to clap her on when she landed. But she did it. So start doing one thing at a time that will get you back on yourself as a priority for yourself. And slowly but surely, you can make yourself your top, not your top priority, but you can make yourself happy again, and you start living well as a caretaker or as a person with illness.
That is awesome. That is awesome and well said. You have a newsletter, I see. How do people get your newsletter?
So the newsletter is actually not up and running, but I do have a blog, and when I get my newsletter going, I will set that back up. It should actually not be there. I'm sorry about that.
All righty. So the blog is just on your website. People can go to
people can go in and
OlgaLuciaTorres.com. For
Yep.
the blog, we've got the website, we've got the email. That is awesome. I thank you so much for sharing with us tonight. And I just want to mention to everyone, I do have a newsletter, which is up and running. And you can subscribe to my free bi-monthly newsletter. Just go to www.ahandbookforlife.com, click in the upper right-hand corner, and get my newsletter to twice a month. Get inspirational tips and hints to keep living that positive life that you've been talking about. So, Olga, thank you so much for spending time with us today.
Oh, thank you for the opportunity.